Thank you for choosing to watch this presentation. My name is Christalla Pithara and I am a Senior Research Associate with NIHR ARC West and Population Health Sciences at the University of Bristol. In this presentation, I will discuss the findings from a study looking into nuisance bleeding in patients diagnosed with acute coronary syndrome and on dual antiplatelet therapy. First, a bit of background to the study. Acute coronary syndrome, or ACS, is an umbrella term describing well-known conditions such as heart attack. Patients diagnosed with ACS are prescribed dual antiplatelet therapy, which includes aspirin and a second antiplatelet agent, usually for 12 months. This treatment increases positive health outcomes, but increases the risk for bleeding. Nuisance bleeding is mild and includes symptoms such as bruising and nosebleeds. Our team wanted to understand how patients respond to nuisance bleeding, whether to access medical care, for example, or stop taking their medication, and what their information needs might be. We also wanted to understand clinicians' perspectives and experiences. This exploratory study, which took part in the west of England, was part of ADAPT, a multi-method study focusing on nuisance bleeding in ACS patients. The study also included a patient and public involvement advisory group, which provided advice and information throughout the duration of the study. We carried out focus groups with patients at the start of the treatment, as well as patients coming to the end. We also carried out one-to-one interviews with cardiologists, cardiac surgeons, and general practitioners, and used framework analysis to analyze our data. 21 patients were recruited and took part in the study. Only one woman participated in the focus groups, and 10 reported during discussions to have experienced symptoms of nuisance bleeding. 17 clinicians were also interviewed. Clinicians, and in particular GPs, reported seeing few patients specifically because of nuisance bleeding. This was reflected in patient narratives where nuisance bleeding was not thought to be a cause for accessing care unless bleeding was uncontrollable. The majority of patients intended to adhere to treatment despite experiencing or being aware of the risk of nuisance bleeding. Reasons given were the role of DAPT for recovery and the belief that nuisance bleeding was non-threatening and controllable. In case of concerns with medication, patients would access general practice in the first instance, even though specialists were more trusted to provide medication advice compared to GPs. Several barriers were reported to accessing specialists, however, such as long waiting lists and having to go through general practice in order to be referred to secondary care. GPs themselves reported the need to get in touch with specialists for advice when changes to medication were considered. Patients had several questions about their medication throughout the duration of their treatment, such as when to stop DAPT and concerns about symptoms and side effects. Questions, however, were not always clarified by GPs. They and their families tried to find information from other sources, mainly medication package information leaflets. Our findings indicate the need for patients to be able to access information about their medication throughout the duration of their treatment. Because of the role of family members in supporting patients with adherence and information needs, family-centered medication counseling that spans secondary and primary care boundaries might be better able to address patients' needs. Finally, future discharge and prescribing pathways need to consider patients' preferences and expectations about their care and medication treatment, but also the challenges that primary care clinicians might face when having to manage complex medication regimens. Thank you for listening to this poster presentation. If you have any comments, please get in touch. More information about this study can be accessed via the link in this slide. Finally, I would like to thank the patients and clinicians who took part in this study and the Patient and Public Involvement Advisory Group for their feedback throughout the duration of the study.